We are now live, Marina.
Good morning, good afternoon, good evening to everybody from wherever you're joining us today, and welcome to this webinar of the Center for Development Impact. I'm Marina Apka, and I'm based at the Institute of Development Studies on the south coast of the UK, and I'm part of the CDI team. And I'm really pleased that today we get to introduce the Causal Pathways Network to the broader CDI community. And it feels like quite an important moment for the work around causal pathways. We're sort of at a point where it's gaining momentum and we're beginning to feel resonance across diverse evaluation communities. So it kind of feels like the right moment to be having this conversation. And over the last year or so, as I've been involved in the network, I've found it to be a really valuable space for broadening and deepening our thinking about methodological innovation in the context of impact evaluation. And this is where there's a lot of overlap with our focus in the work we do at the Center for Development Impact. And CDI is a collaboration with our friends at ITAD, which is an evaluation firm based just down the road, and colleagues at the University of East Anglia. And through our work together, we produce practice papers that showcase innovative methods. We host conversations like this one online, but also in person to learn across our evaluation work. And we also convene professional development courses on key themes, such as contribution analysis as an approach to theory-based evaluation. And our next course actually is on participatory monitoring and evaluation at the end of May. And for the first time, we'll be hosting that in Mallorca in Spain in collaboration with Adapt Peacebuilding and Voices That Count. So if any of you are in Europe and you'd like to join, please do get in touch. So to today, one of the reasons I'm so excited about this work that's happening around causal pathways is that I think it sits at this interesting intersection of two agendas. And these agendas haven't always been speaking to each other. So on the one hand, it's around how we attend to causality in the midst of complexity. And on the other, it's about how we reflect on our ultimate goals of equity and social justice. And the fact that these two agendas are coming together is, I think, super, super exciting. So today, we're really lucky to have an inspiring lineup of speakers who are going to introduce and bring to life the work of this network. So we'll hear first from Julia Lin, who is an incredibly skilled systems facilitator. I've had the pleasure of working with her and seeing how she helps people unpack complexity and causality. And she's our fearless leader on the causal pathways work. So she's going to explain what we mean by causal pathways and how the work is responding to the desire and we feel a need to shift the way we think about and do evaluation. After Julia, we'll be hearing from Carlisle Levine, who is the founder and director of BLE Solutions and has deep and rich experience with evaluation in international development and with philanthropy. And together with Toyin Akpan, who is the director of Oracle Services based in Lagos, Nigeria, they're going to be sharing an example of an evaluation that they undertook with civil society organizations that were advocating for reproductive health and rights that will help us to explore what it looks like in practice and what we can learn from using these approaches. And then Carolina de la Rosa Mateo, who is leading many conversations for emerging evaluators and brings her strong commitment to social justice and her facilitation skills to the network, will talk a little bit about how we can all get involved. So that's our lineup. That's where we're headed. We will have a Q&A session after the presentations. So please do put your questions into the Q&A function. And feel free also to introduce yourself in the chat and share any other reflections. And given the number of people that we're expecting, we likely won't be able to hear from all of you, but we'll do our best to answer the questions as they come in. Also, just to let you know that this is being recorded and live streamed, and the recording will be made available right after we finish the conversation. So without further ado, I will hand over to Julia.
Great. Thank you so much, Marina, and thank you for the very generous introduction. That was very kind. I'm going to be talking with you, just beginning with a little definitional work, and then talking about some myths that are getting in the way of doing some of this causal pathways work. So I'm going to begin by essentially giving to all of us what we already know, a definition of evaluation. If you can advance the slide. We have many definitions over the years, but most of them seem to ground us in the notion that evaluation is here to critically examine the work, programs, interventions, whatever term is used, to examine how it is implemented, to examine the outcomes that are emerging, and to really understand them, how much and for whom. And this is the information that we can then use to inform programmatic decisions. But when we start to explore this idea of causal pathways, and if you can move to the next slide, it isn't just what's implemented and what's changing that we start to ask ourselves. Instead, we go much deeper into why that change is happening, how it's happening, and then particularly as a systems person, under what conditions. I care a lot about that piece. Now, at this point, evaluation becomes really a critical friend in examining causal pathways. It's able to challenge assumptions that we have about how change happens. It's deeply invested in analyzing and making sense, not just of the outcomes that we can observe, but the complex set of relationships that have led to those outcomes and where the intervention that we're attending to fits within those relationships. Now, why is this important? Why do we need to do this kind of next and frankly, sometimes very resource intensive step? As a systems person, I've come to the conclusion that we don't do it enough. Many of the problems that we're trying to solve these days, we now understand are messier than we originally thought. They're embedded in these very complex contexts. And if you can advance the slide, part of what we're dealing with is that we are one of many change strategies and one of many things in the environment aimed at the same types of outcomes or combating change on those outcomes. When we are primarily measuring the advancement of an outcome and we're lightly touching on our beliefs about why it might be emerging, we can make a couple of different types of misinterpretations of how change is happening. We are more and more likely these days, because we're getting better at systems, sensing and understanding systems, to be finding strategies, whether it's intervening at an individual level with people in need or trying to change policy or other parts of a system. We find these strategies and we do them in areas that are ripe for action, which is an interesting challenge, because then when we evaluate and we find our outcomes, how do we know we were needed? Is it even possible that the interventions slowed things down, prevented part of the outcome from emerging that otherwise could have happened, or that only a little bit of the total work we're doing was necessary? When we begin to unpack causal pathways, we challenge our assumptions about change, and we also understand more about how to change systems. We are able to learn with each other and generate new insights. We can also learn from others, because by challenging our assumptions about pathways to change, it is easier to open the door to realizing that there are other pathways that are really important to pay attention to. Okay, so I've had this conversation with many audiences at this point, as have others on this panel. And I have noticed that at about this point, I usually get a couple of questions. One is, if I'm sitting down and doing a deep dive conversation with an evaluator, often they say, well, wait a minute, isn't this what we're already doing? And then someone else will say, I'm doing equity work. This doesn't feel like it's the right thing to do. And then usually at some point, someone says, are you talking about randomized control trials? Is this about experimental designs? So let's combat some of those myths. If you can move to the myths, please. So I am not talking about randomized controlled trials. I'm not talking about experimental or quasi-experimental. There are places and times where those methods are important, but we're talking about messy and complex settings. So let's go to the next slide and see the methods. There are many. This is a short list to get your thinking sparked and excited. This causal pathways work amid complexity is based in methods that are appropriate for finding pathways to change in these very convoluted, very nonlinear settings, and particularly where we're attending to the notion of contribution, not attribution. So these are methods that can help us understand how and why the system is changing, help us kind of honor and equally center other drivers of change, not just our predicted ones, and also make more visible how a system changes more generally and how our intervention sits within that dynamic environment of a system. If you can move forward, we have this very related myth, which is that these experimental and quasi-experimental designs can be implemented with rigor. That's where causal inference is found. So if you're not using them, these other methods, they're not rigorous enough. So here, part of it is the training, right? The history in the evaluation field, and experimental designs, because of how we're trained to think about rigor, can feel like the proof. But let's also challenge that for a moment. Our experimental designs may offer us really strong evidence that one thing led to another, but the design and approach often doesn't tell us why it led, under what conditions and how, particularly other than the variables we predicted mattered and chose to measure up front, which means there's very little room for emergent discovery along the way. Many of the methods on that previous slide, not only are they really, really good at the why and the how and under what conditions, they truly are coming to conclusions about causality. And they're able to do that because there is more than one framework and more than one way of coming to conclusions about causality. I'm not going to sit here and introduce you to different frameworks, but I'm going to challenge you, if you haven't done this before, to go out and look at things like generative causal frameworks, configurational causal frameworks, to start to ground your understanding of causality in some new ways of coming to those conclusions and how you do that work with rigor. One more thing on the rigor piece. In these methods, rigor and deep participation are incredibly entangled. We can't understand pathways without hearing from and engaging and thoughtfully interpreting information with people who are in the system. And of course, I mean those who are most affected by the system, but also those who are agents of change in the system. Many different actors with many different views who can discover different parts of the system that are often hidden from us in order to make sense of how change is happening. This ties very closely into the next myth. You can move forward in the slides. And this one we've been hearing a lot of. Causal designs can't be implemented in ways that are participatory or equity focused or appropriate for working with communities. So you already heard me say it has to be participatory at some level to have rigor, but can it be? Should it be? Is it appropriate? I have a couple of points of view on this that I'm going to share. The first is, at this point, I would say we collectively have knowledge that inequities are caused by a series of upstream drivers, that there are systems dynamics and history behind them, that there are multi-issue, a healthcare problem, a poverty problem, and an education inequity. They're all entangled together. And so one could easily make the argument that absence and understanding of this kind of complex causality, we don't really know how to address inequities, and we're not entirely sure when we see improved outcomes why that's happening and under what conditions we can help it continue to happen. I think we need these methods for our equity work, but are they appropriate? Well, one thing for us to consider is that methods are just the method. They are not the approach. Any method can be done thoughtfully in partnership with community. If we as researchers who come into different settings are capable of learning enough about a community and its culture and the system to do good work, then I think we need to honor that our participants are capable of learning enough about evaluation and research to be strong participants. These methods, though, are also very much designed for and accessible to many different partners in many different roles. One more myth. And this is a biggie. I keep hearing again and again, but we're doing causal work in our evaluations. That's the whole point of having a theory of change. That's what we're doing. We are measuring the outcomes as they emerge. Okay, let's challenge that one. So if you move to the next slide, here's an incredibly simplistic version of a theory of change or a logic model. But just as a reminder to us, we are articulating that there are certain things that need to happen and that there are certain things that will result from doing those strategies and outcomes. Depending on the complexity of the environment, the way we're approaching it, we might also weave in a whole bunch about the context. And we might think about how early outcomes are laying foundations for later things to happen. But when we are doing this work, if you can move forward, we tend to, as evaluators, be the most focused on, and just keep going to the next slide. Sorry about that. We tend to be the most focused on measuring. You can keep moving through this. It looks like there were animations in there. You can keep focusing over and over on the strategies that we believe were the right ones, and we measure them, we assess the quality of implementation, the quality of engagement in them, and then we look at the outcomes. But if we're doing causal work, that's not really where the majority of the deep thinking is happening. It's actually on the arrows in between. We are most interested in understanding if we've observed an outcome, what caused it. And if that outcome didn't happen, what prevented it? And also, if an outcome we didn't expect happened, how did it show up and how does it relate to the rest of the system? The arrows are our tool for understanding causality. And it looks different to measure change at that level than to observe where change has happened. So we have these myths in mind, and I'm hoping I'm beginning to kind of shift your thinking a little if you were holding any of them. But in practice, the application of this work, doing causal analysis really thoughtfully in participatory ways, is actually how we discover the value of it. So I'm going to turn this over to our team who's going to be sharing a most significant change evaluation. If you remember, that is one of those highly participatory methods, methods that engage in very deep thinking with people who are embedded in the system and can see it in ways an evaluator can't. All right, thank you so much, Carlisle, if you want to jump in.
Great, thanks so much, Julia. It's thrilled to be here. And I also want to do a shout out to Rise Up, the NGO with whom we were working on this project. I think some Rise Up staff are here, so that's really terrific. So we're going to talk about how we used most significant change to understand causal pathways. Next slide, please. So Rise Up is an international NGO based in the United States, and they have a program called Champions for Change in Nigeria. It's helping civil society organizations advocate for healthy families. There's a robust model, which you can see here with all the activities in blue, and then the results are to the right. And of course, in our evaluation, we were embedded evaluators from the very beginning. And so we were able to ask in our early days of, were these the right activities? Did they meet the participants' needs? Were they relevant? And then we were able to ask a little bit later about advocacy strengthening. And then finally, where we want to focus today is a little bit later in the time of the program and in our evaluation time with Rise Up. What was resulting and how did these results come about? Given the timing, we actually focused most on that result in the upper right-hand corner about policymakers and policy change. And what we wanted to know, there was a cohort of CSOs who were participating in Champions for Change, and they were saying, as a result of our advocacy, policymakers are doing things differently, or policies have been passed, policies have been implemented. And we wanted to test that. We wanted to learn more about those changes, and we wanted to learn how they came about. So that's where we were focusing our attention. Next slide, please. The question was how best to understand this. So we knew a couple of things about ourselves and about this evaluation. So first of all, because we're talking about advocacy and policy change, which are complex processes, we knew that we wanted a non-experimental approach that would allow us to do a process analysis of how things were changing. So we were considering contribution analysis, most significant change, and outcome harvesting as we thought about which method to use. We were accompanying the initiative as a learning partner. We're using a developmental and a participatory evaluation approach, and that kind of leaned us toward most significant change in outcome harvesting, although contribution analysis can be done in a participatory way. Most significant change in outcome harvesting seemed like a more natural fit for the people with whom we were working. We were also interested in emerging outcomes that hadn't been predefined. And again, that pointed us toward most significant change in outcome harvesting as the possible methods of choice. And then finally, we were following the work, as we said, of 12 civil society organizations. That seemed to be too many outcomes to go with contribution analysis, which it takes a lot of time and effort. It seemed like too few to go with outcome harvesting. I find for me, the value of outcome harvesting is when I can look across 400 outcomes and draw out lessons learned. Well, we weren't going to have that many. So most significant change seemed like the right fit for what we were going to do. We did, of course, adapt it to better get at causal pathways. And I am going to pass to my colleague Toyin, with whom I had the pleasure of collaborating on this project, to talk with us about that.
Thank you very much, Caroline. I'm happy to be on this presentation. And so how did we use most significant change approach to evaluate the work that we needed to do with RISO? Even though we know that most significant change as a methodology is very participatory and is not designed as Julia earlier explained, but what we recognized that it was that we needed to unpack stories that we collected over the period of 2.5 years, learning about how change has evolved for these individual civil society organizations who started off as service delivery agencies, but now moved on into hardcore advocacy work. And so we needed to understand how are changes occurring at individual level, as well as the organizational level, and that is leading on into the political and policy level areas. So we decided that we were going to use significant probing as our approach to learning about change, and that is related to other stories. We would like to see that though there are steps in most significant change methodology, we adapted the steps as we could fit it into the work that we did. The first was that who selected the most significant stories? The partners, the civil society organizations did the selection, but the selections were done in stages. And so the question was, did you observe any change? And then which one was most significant in all the changes? And then we now had a script that we were able to use in speaking with them. Primarily, we asked questions about what contributed to the change that you were seeing, both at the individual level as well as the organizational level. That now moved on into changes within the communities where they were intervening that led to political and policy changes. How did the changes come about? What happened? Who was involved? Who contributed to the strategies? What changes happened on the strategies? What are the outcomes that are observing? And which other individuals or organizations contributed to these changes? And if there is none, why didn't you have changes in this area that you anticipated to have changes about? And what should I have done differently? Next slide, please. With a series of stories that we collected from all the partners at different points in time, how did we apply rigor into our evaluative work? We did that by triangulation. And so we triangulated on 3 points. One on the method. Sorry, go back, please. And then we also triangulated on the data sources. We collected information and reviewed documents, which we triangulated with the information that we collected from interviews, but from all the stakeholders, the civil society organizations, as well as the policymakers that were involved at different times. The data, like I said, was collected over a period of 2.5 years. And so we collected information across the different time points. We looked for consistency across our findings. And wherever we found inconsistencies, we went back to either the stakeholders that provided the initial information, or we cross-checked with other stakeholders or other levels of information. And so there were a lot of going forth and back in the triangulation method. Next slide, please. This is an example of defining our causal pathways. The project was trying to increase the state's commitment to providing free maternal and child health services in Kano State, in up north of Nigeria. They had so many complexities that they were dealing with. They had issue of not being able to afford quality health services. They had issues around the health facilities not properly equipped to do this. And they had other issues around the populace not really trusting the skilled worker to provide services. And so there are several layers of barriers to providing these services, as well as barriers in demanding for these services. And so what did we look at in terms of putting this through to you to understand? So through our deep probing of these significant change stories, and through our triangulation of methods of data sources and the timeframes for data collection, we were able to capture the story that tells you how change came about. And we found it credible as well as accurate. One, because it didn't come from one source, it came from many sources. This story started in 2015, and it built upon the collaboration that YOSPIS, that's the Youth Society for Prevention of Infectious Diseases, had with other organizations and other cohort members that Champions for Change supported. They, in terms of their intervention, brought in 3 additional partners who were already experienced in advocacy work, looking at different components of providing maternal care services. However, that had never been very successful in their work. So based on the new funding that they got from C4C Nigeria, they were able to relaunch this advocacy work and then provided some launchpad to start a new movement and alliance. Based on this, one of the partners whose core competency was in research undertook to provide more in-depth into the issues that they had to deal with by conducting a research. Based on the research, they realized that they needed input from the State Ministry of Health to do some work. So the story is around who did what. At what time did you realize that you needed the intervention with the state government? At what time did you notice that the result that you got, you couldn't have done it all by yourself, or crystallize into them sitting down at the table and looking at, okay, then we got to a point where we now said, for us to make a change, we needed the state to have a document to refer to in terms of the quality of service. And that led them to the service charter. So developing a service charter help them to crystallize all of their understanding and all the changes that they anticipated the state to take. And then the next question was, what next? They said they realized that they needed the health commissioner to agree that this work will promote the ownership of the state and also give them the leverage that the policy needed. And so the involvement of the state commissioner was sought. And then we got more stories about then what happened next. And they said, oh, after the health commissioner bought into the idea and saw the need to intervene, he gave them the idea of validating their research findings and also upscaling the advocacy work with the state government. With this support, he paved way and opened doors for more changes to occur. The first change started with him because every emergency services is always provided with a vehicle of ambulance, and a vehicle meant a proper vehicle car. In this case, they were dealing with rural areas where there are no proper roads for the vehicles to ply on. And so the change first came from him, and he explained how he adopted the use of the tricycle ambulance, which was the success story that they learned from another partner of where it was used in another country. And so they brought the story of learning from somewhere else to be able to implement it. And the state commissioner bought into this innovation and then gave room and said, I will support this, and then you can go ahead and still continue with your validation, and let's see what the government was going to do on the long run. Bottom line is that at the end of the project, at the end of the evaluation, we found that there were so many changes at different levels. There were complex changes, complex problems that were solved. And there were so many champions that this program provided. If we had used any other method to collect this information, a lot of the stories would have been lost. And so we found value in following change and how change occurred across the levels and across the years to be able to validate their own stories and also to give them credit for the work that they have done. Over to you, Kalai.
I won't take much time here because I know our time is short. Toyin, thank you. That was a wonderful description of our work and then of the work of Jospis that we captured. I think maybe I'll just highlight one of these lessons learned. All of them are important. I think Toyin has spoken to most of them. But one thing that I really valued in this project, I was working remotely from the United States via a Zoom connection. Toyin, in contrast, was actually not from the local context when it came to Jospis, but at least from the national context, and was able to go to Kano to conduct research about what Jospis had achieved. So the first round, I did an okay job collecting data remotely from a variety of different actors, but what a difference it made that Toyin, you were able to go to Kano, talk to all the people who were involved, see for yourself what was taking place. And I felt that really raised the level of rigor of the story we collected to a much higher level. So I just like to highlight the value of having evaluators who understand local context as part of rigorous activities such as this. Over to you, Carolina.
Hi, everyone. My name is Carolina La Rosa Mateo, and I'm an independent consultant and also the project manager supporting Julia Lynn on the Causal Pathways Initiative. So thank you to Julia, Carlisle, and Toyin just for laying the groundwork and sharing great examples of Causal Pathways work. And if after listening to this presentation, you are excited or energized and want to learn more, you can by being a part of the Causal Pathways Initiative. So as you can see on the screen, this new initiative seeks to make visible the black box of strategy and systems change using evaluation approaches that make sense of causal relationships, like the one that Carlisle and Toyin talked about today. And it essentially consists of a network of evaluators and funders that are engaged in actions to make these methods more accessible, visible, and understood. So we launched earlier this year. We have our website, which is listed here. And on there, you'll see various ways to get involved. And there's opportunities for causal pathways, whether it's the first time you're hearing about this or whether you're an expert. So some examples of how you can get involved include being advisor work by becoming a network member. In a few months, we will be kicking off our Brain Trust, which will be an opportunity to get expert advice from an advisory group for evaluations. On our website, we're developing a resource hub that's going to be growing over the next few months, and that's going to offer opportunities to gain knowledge, to expand your skills and understanding. If you're already doing causal work, we definitely want to hear from you and hear your studies, examples of case studies that show the value that causal analysis brought to those affected by the evaluation. And finally, later in the fall, we'll be hosting a virtual symposium So definitely join our mailing list on our website or join our LinkedIn group, which is linked on our website, so that you get the save the date when it comes out in the coming weeks. So lots of opportunities to get involved. And again, like I said, doesn't matter where you are with causal pathways. Maybe you're at the beginning, maybe you're an expert, but there's many opportunities to learn and get connected to a group of individuals that are strong advocates for this. So thank you, and we hope to hear from a lot of you.
Fabulous. Thank you so much to everyone, to Julia, Carlisle, Toyin, and Carolina for your brilliant presentations. I'll stop sharing, which I think really complemented each other in highlighting sort of the high level of why this is important, but then kind of digging into what does it actually look like. And yeah, as Carolina says, I'm really looking forward to hearing and seeing more and more examples of what does this work really look like in different contexts. So we've got some time, good amount of time for some Q&A and discussion. There is also, just to alert you, there's a raise hand function, and there's the Q&A function. So if you have something you were burning that you wanted to really bring into the room, please do feel free to raise your hand and we can unmute you and invite you into the conversation. But I'm going to turn to my colleague, Gil, who is the director of the Center for Development Impact. I think you have a couple of questions you wanted to put to the panel to get us warmed up.
Yeah, there were some questions in the Q&A, which perhaps are good starters for the discussion. One question that was asked was that a key critique in assessing the causal pathways is the potential disregard to unintended effects. Can you provide information on how the different methods can also capture these unintended changes?
Great, thanks, Gil. Does anybody want to jump in with that? Julia, do you want to maybe?
Sure. So some methods are better at this than others. There are methods, in fact, you heard about some of them with outcome harvesting and most significant change that are particularly good at finding many different types of outcomes, intended and not intended. The qualitative impact assessment protocol is another one that can do that quite well. Part of the strength of this type of process is also understanding why those emerge. So not just discovering for perhaps that a harm was caused or that a benefit happened in another part of the system, but understanding the relationship between your work, why it happened, and under what conditions that same type of outcome could continue to happen.
Thanks very much, Julia. I wonder, Carlisle and Toyin, in your example, in your work, how did you grapple with the unintended?
Toyin, do you want to take that?
Yes, thank you very much. One is, we didn't expect that the journalists on the project that I just mentioned will start another movement that will lead to increasing a lot of support across all spectrums. That was unexpected. We didn't expect that beyond the policy work, beyond the partners, and that another network will kick off from there and begin another line of change that strengthen the advocacy work of the partners who were evaluating. We weren't expecting that. So we needed to take that into consideration. So how did it affect us? We give more time to collecting their stories and then also probing them to be able to see the connection between that unintended result and how it impacted on the result we're looking at. That was a positive one. The second one was not too positive, and that was that the government agreed to increase the subvention for maternal health care by 25% only. And they were going for higher than 25%. And so it was because the connection between poverty was not well highlighted in their asking. And that was unexpected. And what did we do? And then I asked them, but what would that make? And what difference will it make? Do you know what they did instead of telling me stories, they actually took me to the community where the poor who couldn't even afford to pay for any service were scrambling to just get the doctors to see them. And they were pregnant women. And they asked me a question. Even though we didn't get the 45% we argued for, getting 25% was good enough. But I would just wanted you to know, down south, you probably don't have these issues, but the context for which we were intervening, even 1 naira, which was less than $1, was not affordable for them. And so both ways you see, if we listen well enough for stories to emerge, there will be intended and lots of unintended, both negative and positive. I think it's the more we listen more on the stories, the more we're able to stay on longer than just collecting the stories for that period and try to see the connections it makes in the lives of real people, not only the outcome or the impact that the organization is seeking to prove, to see the lives of people change. So you see evolution as continuous, then we get to richer stories. Then we get better recommendations that can affect the real lives of people. That's the way we've dealt with it, but I think that's
Brilliant. Thanks so much, Toyin. It's a really powerful example of how storytelling narrative, which a lot of participatory methods are, give you that full, rich picture in context. No, brilliant. I see we've got a hand up. Baru Douthwaite wants to come in, and I am now going to unmute you and allow you to speak. Baru.
Oh, thanks, Marina, and hello, everybody. Yeah, I just wanted to say hi, to introduce myself. I've been working on causal pathways for quite a long time now, although I call them different things at different times. Impact pathways, and now these days outcome trajectories. And I've done a few now, I think 8 outcome evaluations for different CGIAR programs, and I just wanted to share the way I've been framing it, because it might be useful. So sort of assuming at the beginning of the evaluation, sort of the a priori assumption that any outcome that a program would like to take some responsibility for or claim will have necessarily evolved from, I think, what you call a causal pathway, and what I call an outcome trajectory, which is a patterned and evolving set of interactions between actors and knowledge and technology and institutions. And so the outcome has emerged from something. That something is real. It happened, it's there, and it's your job as an evaluator then to kind of unearth it through using timelines and talking to people and just sort of triangulating and sort of getting the story out. And using, an important part of that is also using some published theory as a way of kind of structuring or what you look for when you're describing these outcome trajectories. So I just wanted to share that, and hope it's useful.
Thanks very much, Baru. Yeah, no, it's the outcome trajectory idea, which I'm familiar with, is it also brings in the point around temporality, which Carlisle and Toyin, you talked about following change, no? And often, I think, when we're talking about causal pathways and emergent change, what are the methods that help us see that and how that's going to move? So I wonder if you might say a little bit more. In your example, you talked about being embedded evaluators. If you could say a little bit about what conditions do you think actually allow us as evaluators to not just see change as it's happening and describe it, but to follow it, right? That idea of following change through time. How did that work in your case?
I need to speak well to this.
We were part of the project set up a WhatsApp group. And so we were silent participants on their discussions. We were invited into their meetings. And so we could listen to their conversations. We also had the opportunity of having our evaluation structured in phases. And so we had direct interactions with them at different times. So we had the phase 1 that was looking at their individual changes. And so that gave us more time to have build relationship, talk to them about the changes that they were seeing. So I think we had so many opportunities that we kept on exchanging conversations around their work, and they knew they are free to always call upon us if they needed the service, or they needed to bounce some ideas with us about what they were seeing and they didn't understand. At the same time, they also gave us space enough to be objective about what we were doing with them. I don't know whether Carla would like to say 1 or 2 things that I must have missed.
I felt like it was so generous on the part of Rise Up and the Champions for Change team to invite us in. And the beauty of everything you're describing, Toyin, was that there was a real sense of trust. And we understood, and so they felt comfortable speaking to us. They knew we had a learning perspective. There were feedback loops. So, Toyin, you would talk to the participants, and then we could feed that back to the team. And then, that influenced how this was a pilot. So this influenced how this was being designed. Now it's a very well-established approach. So that trust was super important. I feel like there's another thing I was going to say about that. I think I'll leave it at that, with trust being as a key point.
Brilliant. Thanks so much. Yeah, the trust in the process, but also you mentioned, Toyin, these sort of slightly different roles, the insider-outsider role, being the critical friend. And that's also a trend we see a lot in international development, is the learning partner approach to evaluation, which is a great opportunity for doing kind of much more of this kind of work. But Julia, I wondered if you wanted to reflect also on this point around time, and how change evolves and emerges from a sort of complexity and systems perspective. How do we grapple with that?
So one of the concepts we use a lot in systems change is the notion of delays, that often an intervention in the system, even a very proximate, the outcome that is closest to the intervention might take quite a bit of time. We think about how social movements, for example, can very slowly change narratives or change them in one part of a system and not others. How often the policy change process, between the time you start surfacing and making visible a solution, the actual change is very delayed. But we also think about it individual level outcomes. We can have significant interventions in a system that can take years to ultimately address inequities on the ground because of all the pieces of the system that have to shift along the way. And so for that reason, the notion of following the path over time becomes very critical. Otherwise, you can quite easily lose track of when you had an impact. And you might also lose track of when the impact finally did emerge because this other thing also happened. The pathway over time in systems change also gives you moments to know when you need to reinforce or protect something that seems to be working and making progress, but is still really far from the desired outcome. And that also prevents you beginning to believe you haven't had impact, right? Because you are looking for all those little things that maybe are changing along the way that you can see your contributions to. Thank you.
Great, thanks very much, Julia. So I think what we're seeing is that, as I was saying sort of initially, I think the systems framing and some of the causal pathways work and the way in which we're talking about these methods, I think does give it a particular angle, and it helps us think about the methods that not just allow us to see change from within systems and appreciate how that is emerging, but to then sort of follow it through time. And going back to Carla and Toyin's example and the reflections on trust and how you build that in that sort of ongoing process of reflection being really, really important. But it's also true that the methods we're talking about, one of the critiques of them is that they're actually quite difficult to use. You need a lot of expertise, right? So we're talking on the one hand about participation and empowerment. On the other hand, we're using methods that are quite technical. So I wondered if any of you had any insights or ideas about ways in which these approaches and these methods can actually be used by social movements, by local community organizations, to understand how those processes that they're deeply, deeply embedded in and how that change is emerging so that they can be, if you like, driving that process of inquiry around causal pathways. Anybody?
Maybe I could say a moment about that with most significant change and outcome harvesting, and then Toyin, I would pass it to you for anything additional. And those methods are very well designed to be taken on by whomever is involved in whatever process. It's storytelling, and storytelling is something that we do naturally. And so we have plenty of examples of where we actually trained whoever was participating, whatever they're participating in, to collect stories, whether it was the most significant change kind of story or whether it's harvesting outcomes. I think where it becomes a little more challenging is then, okay, so what do we do with these stories, or how do we make sense of them? And certainly we have facilitated a lot of situations where we bring people together and help them make sense of them. And so there might be a little bit more training involved in that sense-making process, or maybe there needs to be an outside hand that can help it with that at first. And then people very quickly are active participants in that as well. But Toyin, what would you add to that?
I think I would like to answer one of the questions that was posted by adding that sometimes the stories that you hear, you need to hear it from different sources and from different places to be able to validate what is the truth of the matter. But you need to accept also that there are perspectives in storytelling. And so each person is telling the story from their perspective, and they might have not the benefit of seeing the other person's on the context. So how do you validate your stories? It comes one from experience, but you can learn it. It comes also from practice. You can do it again and again and see whether the same answers that you get is what someone else who's more experienced in harvesting stories will get you. But there's no end to using stories and collecting more stories until you better understand the story yourself, that you can explain how change has come about, and you can actually pinpoint who contributed more, at what point, for what reason, who became the champion at that point, and who became, like the creator of the movement and step back so other people can join in. What exactly is making a difference here? And who is it making a difference for? We all as evaluators have that already as skills we can use. We only need to build up on how to use it well and to be able to save time. Then also, I need to see, you cannot box yourself when you're following a story. And so the journalists know this very well. And they say a story is building or a story is brewing. It actually builds up. It takes time to be incremental. We need to do that. And we need to believe the stories, because you need to believe what people are telling you. I can't tell you any story about you. But I can tell you a story about myself. Believe my story.
I love that. I would just add one more thing, which is it is easy to get caught in our habits of writing up analysis and writing up stories, but having people visually draw how they understand change has happened, use pictures, even move through a room with each other to tell the story. Often there are amazing discoveries when we get outside of the very linear and left brain thinking, in part because it frees us up to remember experiences and accept new information in different ways. And even just comparing 3 or 4 different drawings can cause people to challenge their own thinking and get excited as they start to think about other things contributing to the change.
Brilliant. Thanks so much, everyone. We've got a couple of minutes left. And Carolina, I'd like to turn to you for our last few minutes. So you're working, I know you're very active in lots of communities of emerging evaluators, right? And in some ways, I think about some of these myths, and I wonder how much of that is baggage of the past, of those who are gray already, right? So as someone sort of coming into this practice, and particularly these points about more creative narrative methods, I see amazing work being done, right? Where do you see the trends? How do you see this moving into the future? And what do you think people are asking for to be able to do this work, do more of it, and do it well?
Yeah, I think the point about the myths is a really important one. From what I've seen, just kind of getting people shifting their mentality on causal pathways. So understanding that a lot of times our evaluations have causal thinking, but that's not necessarily mean that a causal analysis is being done. So that mental shifts about what's possible versus what's not possible with causal methods, I think, is a really big one. I think people are hungry for strong examples, and not just on what looks good or how something has been done well, but also when it's not being done well. And I think also just, certainly we're trained in certain methods to believe that certain methods should be done in certain situations and not others. And moving away from that, again, that mental shift is really difficult. So like for me, I come from a public health background and have a master's in public health. And before coming into this, in public health, a correlation doesn't equal causation. That's what's coming through my mind. This idea that nothing necessarily, you don't want to put that causal label on anything. That's too strong. That's too risky. So I think it's difficult to move on from that. But I think the great work that this initiative is doing is showing that experimental isn't the only way, that there are other ways to show strong causal links between the great work that a lot of organizations are doing, and that ultimately it'll show the impact of the work, which is what that's what we want, right? That to make sure that the work that we're doing has a strong impact. So that's kind of where I see things right now.
Thanks so much, Carolina. And thank you to everybody. Just to acknowledge that there's been a couple of comments about other methods like qualitative comparative analysis. And of course, the range, there is a range of methods, but as Carolina was saying, where are the examples of not just how they work, but how they can go wrong? And I'm a real fan of talking about what doesn't work. I think our deepest learning, right, comes from when we actually appreciate how something didn't work very well. So look out for more of that coming from the Causal Pathways network. At CDI, we have a series of practice papers. So if somebody's listening out there and you think, I've actually got a great example that would work nicely, get in touch. And yeah, we look forward to the conversation continuing. So thank you so much, Carolina, Toyin, Carlisle, Julia, for being with us, Gil for support, Baru for jumping in with a great comment. And yeah, the link will be sent, the link will be sent to everybody, I think, on Thursday. So thanks everybody for joining us.